Good morning and welcome to our webinar. It's lovely to have you joining us this morning. Um, we've got a really relevant topic and we've had a really wide range of questions that people have asked. So that's wonderful. Thank you. Okay, so we're hosting this webinar, the Nursing and Allied Health Professional Programme at Cancer Research UK Cambridge Centre, and we've got this wonderful panel of experts here. I'd like them to each introduce themselves. Um, Nicola.
Hello, hi, my name's Nicola Day. I am a clinical specialist physiotherapist in oncology, rehab, and exercise. I'm the service lead for REACT, which is our cancer rehab program here at Addenbrooke's in Cambridge. I am a qualified cancer exercise specialist. I've spent some time in the US at the Rocky Mountain Cancer Rehab Institute as well. Dabbled a little bit in research, but my main interest is really sort of translating what's coming out in the research about exercise oncology into practical application within the NHS.
Lovely, thank you. Claire.
Yeah, my name is Claire Traub and I'm a specialist occupational therapist. I work in the enhanced supported care service at Addenbrooke's in Cambridge, supporting people with incurable but treatable cancer to be as kind of active in a meaningful way as they'd like to be. So that's my perspective, overcoming those barriers such as fatigue and engaging in life in the way they want to.
Thank you. Isaac.
So, hi, my name is Isaac Oppong. I'm a PhD student in exercise and oncology, looking at how exercise can be effective in the community. And also, I'm the co-founder of OncoMove, which is a free 12-session exercise program that's run online.
Thank you. And Joanne.
Hi everyone. So I'm a clinical specialist myeloma physiotherapist at University College London Hospital. I co-lead our prehabilitation service for myeloma patients who are having a transplant, and I'm also a research active as well. I'm really passionate about improving patients' quality of life and really educating people about the benefits of exercise and yeah, we're helping you recover from your cancer diagnosis.
Wonderful, thank you. So I think you'll see that we've got a wonderful panel here with a breadth of experience for you. And my name's Laura, and I'm a dietitian by background, and I co-lead the Nursing Allied Health Professional programme here at Cancer Research UK Cambridge Centre with Cherry, who is in the background here and helping to answer the questions as we go through. So we've had a wonderful load of questions that you've sent through beforehand. So I want to give most of the time that we've got here today to looking at those questions that you've asked. If other ones come up as we're talking, then please feel free to put them in the Q&A and we will answer as many as we can while we're here. Okay, so I think a good place to start is to look at what we mean by physical activity, because we've called this physical activity and cancer. So just what do we mean by that term?
Yeah, I can answer that question. So, physical activity is any bodily movement that is produced by your muscles. So this is normally scaled and we look at it from light, moderate, and vigorous intensity. So when we look at light intensity exercise, it would look at it would look at um, it would look at stuff like casual walking or household tasks. When we look at more moderate intensity, it looks at vigorous, um, brisk walking. And then when we look at more high intensity exercise, we're looking at jogging or kind of sport-based exercise. So I think the beauty of exercise and the beauty of physical activity is the fact that when you look at we look at these intensities and we go through them, even at a very light intensity, we can see the impact that exercise can have. For instance, when we look at 10 minutes of hoovering, it can have an effect on your executive function during that day, and that executive function is just your decision-making skills. So we can see that from even from the very light intensity exercise, physical activity and exercise can have a huge impact on your physiology.
Wonderful, thank you. So we see that it's quite broad, and a lot of these different things that we enjoy can have this positive impact, not just like putting on the sweatbands kind of that some people associate with exercise. Okay, so another question that's come through, why is physical activity and exercise important for individuals undergoing treatment for cancer?
So this is, I could answer this as well. This is kind of a growing and really huge field. So a lot of the exercise, a lot of this started in aerobic exercise, which is those cardiovascular exercises. A lot of the research started at this basis. But what we know is that exercise plays an important role during cancer treatment. It helps patients to manage many of those physical and psychological effects that they experience, whilst also supporting the quality of life. So a lot of the research is based on improving your quality of life, fighting against cancer-related fatigue, and helping manage those side effects that come with treatment. So I think one big factor that I think we'll kind of express today is that it's meant to meet you where you're at. So when we're looking at exercise and physical activity, especially during treatment, it's about every bit of movement matters, even if it's the lightest intensity all the way up until the high intensity exercises. We know that when we're looking at more resistance training, that the effect that it can have on your body is in protecting that muscle mass and protecting that function and increasing that strength as well. So it's sometimes looking at the functional capacity. So what can't you do? Is it going up the stairs? Is that a bit difficult for you? Then it might be practicing going up the stairs so that that everyday activity becomes a little bit easier. But we also know that there's links between exercise and improving your tolerance during treatment. Even though that research is quite new and it's quite advancing, we know that when we're looking at breast and upper GI cancer types, that tolerance to that tolerance to chemotherapy is actually improved when you're exercising during treatment.
Wonderful. Thank you. And obviously we'll go into some of this in more depth in the next hour or so. So someone else has asked if there are any guidelines on the recommended physical activity levels during and after cancer treatment.
Yeah, and I can ask that one because it's a really great question and it's one we get asked a lot. And it always really surprises me, really, when how many of us don't really know what those guidelines are. But the Chief Medical Officer, and I think Nicola's going to put up an infographic in a minute just to talk that through. And what we're looking for is for adults, including older adults, and also those living with cancer. The guidelines are all the same, and we should be aiming for around 150 minutes of moderate intensity exercise. And just like what Isaac was saying, that moderate intensity is anything that makes your heart rate increase, and you can still talk, but you couldn't sing. And those are, like Isaac said, brisk walking or slow swimming and slow cycling. Or alternatively, you can do 75 minutes of vigorous activity, and that's where you're breathing a lot harder and faster, and maybe you couldn't talk or sing. And those sorts of things that running, fast cycling, or swimming, or playing sports. But on top of that cardiovascular side, there's this other thing of having two strength-based sessions per week. And that's like your Pilates or gym-based exercises. But they also recommend balance activities again at least twice a week, particularly for older adults to reduce those risks of falls. Now, when we look at the general population, we see there was a study done that showed that in those without cancer, 69% of men and 66% of women maybe meet those cardiovascular recommendations, but only around 28 to 25% of women meet the strength-based guidelines. But when we look at cancer survivors, unfortunately, the numbers are even lower. And the studies show us that only between 18 to 28% of cancer survivors will actually meet these recommended physical activities. And it's really interesting because what it shows us is just like this webinar has shown us, so many patients are really interested in being more active, but there's lots of barriers that come with that, like the treatment side effects, those psychological barriers, which we all have, a bit of low motivation, and, reduced confidence of how you can move with your body. And then there's all the environmental areas that we all have, which is the weather, which isn't today because it's very sunny. I hope it's where you are. There's also time, trying to fit that exercise in with lots of medical appointments. And I guess the most important thing that we can kind of say is that we know there's an opportunity for us healthcare professionals to sort of support and really give you education and guidance and reassurance of physical activity. And just like Isaac was saying, has got lots of benefits. And, make sure you bring it up with your provider and ask them what you can be doing. And as healthcare professionals, that's something we should really integrate into all of our conversations with patients.
Lovely, thank you. So what you're saying is that the recommendations for the general population also are relevant to people who are living with cancer and having cancer treatment, but what you're looking is kind of to push yourself a little bit more, and that's going to be a different thing for different people. But it's something that we can all get involved in, which is
Yeah.
one. So I'm going to ask the next two questions together because I think that they work well together there. The first one is, what advice should I give my clients about exercise? So that's from a professional there, it sounds like, who's asked the question. And where do you start with getting patients more active, i.e. how to introduce the guidelines into practical care, sorry.
That's okay. And I think I can answer that one because I kind of briefly was touching on it. And I think as healthcare professionals working with patients affected by cancer, we know that there's so many benefits, a bit like what Isaac was saying. And so just to give you a typical thing that I maybe see in clinic is that patients start to experience those symptoms of, fatigue and pain, or maybe you've not slept very well because of your treatment. And what we tend to find is that patients aren't really sure about the activities that are safe that they can do. And so what happens is that they avoid activity because we don't talk about it with our patients. Patients aren't sure what to do. And so we just naturally then don't do anything. And when we don't do anything, then you actually lose that strength and you lose that sort of physical fitness and we become deconditioned. And then what happens is that day-to-day activities then become harder. So just like what Isaac was saying, then climbing the stairs becomes a bit more difficult. Walking down the shops, it becomes a bit harder. So we start to use the car maybe a little bit more. And what happens then is that it makes life just a little bit harder. And so it really impacts, patients' quality of life. And they don't feel like they can do the things that they used to be able to enjoy, which then has a knock on your mood, and your well-being and feeling frustrated. And I think this is, as healthcare professionals, it's showing them that deconditioning cycle and also showing that actually exercise is a great way that we can impact and actually stop that cycle from happening. Because what happens is that, and we educate patients, is that actually physical activity or exercise increases your strength, it improves your fitness. So day-to-day activities become easier. My body doesn't have to work as hard to climb up those stairs when I'm stronger and fitter. And it allows us to sleep better, which means I can go back and see my friends and do the things that I enjoy. And so I think what's really important is really emphasizing that to our patients and showing them how exercise can really help support them from recovering from treatment and also preparing you for treatment. And a bit like Isaac kind of touched on, improving your tolerance to manage that treatment better. And I think the overall message is that to give to our patients is that movement's really important. And even small amounts of activity can really make a big difference and really showing those benefits. And one of my favorite lines that I use with patients all the time is movement is medicine, and even small amounts of activity can really make a meaningful difference during and after your cancer treatment.
That sounds wonderful.
Yeah, and if I just follow on from that, the second part of the question was, how do you start getting patients more active? And just echoing exactly what Joe said, and those guidelines, they are end game. They are something to work towards. There's a huge number of our patients that just could not go straight into that moderate intensity exercise regime straight away, and so that might be because their treatment, their pre-existing comorbidities, it might be their own exercise experience. And so sometimes we really need to try and find a different approach, a different starting point for our patients. Some of my patients, I will go right back to the beginning, and actually we'll talk about reducing sedentary behavior. to begin with. Okay, just breaking up that seated or lying down time when they're awake during the day, trying to get them a little bit more physically active. You might bring in exercise that's specific to them. So it could be upper limb exercises because they've had breast cancer surgery. It might be deep breathing exercises and breathlessness recovery because they've got lung cancer or lung disease. We'll bring in something that's more specific to them, all the while just chipping away at becoming more and more physically active. Sometimes as well, I will come in a slightly different route, and I will encourage patients to maybe join a Pilates class or Tai Chi or yoga, and those are things that we use quite a lot in our service here in Cambridge. That often builds a rapport between the patient and myself. You can't underestimate the power of being in a group, and that peer support, that group cohesion, that might actually be the thing to motivate a patient to be more active, to participate in more regular exercise. And that might be before we even discuss about moderate intensity. So you're working up to that. And patients may fit in anywhere along that spectrum, really. And the benefit of coming and speaking to an individual is that we can help you find where you are on that spectrum, on that journey, and kind of go from there, rather than being, dazzled in the headlights of being told to do 30 minutes moderate intensity exercise on 5 days of the week. That can make a lot of our patients just run for the hills, really.
Wonderful, thank you. And I think part of it is about things that you can do just in your everyday as well, isn't it? Integrating into your life. And it used to be sort of decades ago that someone was not well, and with all the love in the world, the friends and family want to do everything for you. But if you don't even get up to make your own cup of tea, that's like an opportunity missed. I'm not saying don't make the cup of tea for someone, but sometimes there's little things that actually, if we take all these tasks away from someone, they miss out on that opportunity. And maybe to go for a walk, with social walk or something like that, is a nice opportunity to move a bit, as well as doing something nice or playing with grandchildren or something. Lovely. I just wanted to put in that there was a comment, really, rather than a question in the Q&A there, about what you were saying there, Joanne, about that was a really good point that you were making, and the questioner is saying that they wish the kind of advice was embedded in diagnosis so that people could start from day one. And I think that's something that we would all stand behind, isn't it? That we can get this information there. I mean, even before, out for the general population, but if it's something that people can get early, then they can benefit more from it. So I just thought I'd add that in because that was relevant for what we were saying there. Lovely. Oh, and also, sorry, there's another question about if someone's struggling to get enough nutrition, and they're worried about losing weight, and then that's difficult to then be doing the physical activity. Then, I mean, we do have a separate discussion all about nutrition and cancer. So there's a bit more detail in there to go through that. But I think it is difficult because as healthcare professionals, often we talk about people's weight and we don't want you to lose weight, but weight's quite a crude measure of assessing someone. And actually, if all you want is the number on the scales to go higher, then you can sit still and you will probably gain more weight than if you move. But that's not really kind of clinically the best thing for you. And actually, even if your weight doesn't go up, if you're moving a bit more, then you're in a better condition and you're healthier. So you just said nutrition, so I was jumping in there. But there is more details, and when this discussion is published, there'll be the link to the diet and cancer discussion that we had. So there is more detail in there if someone would like a bit more detail on that one. Okay, let's look back to your questions. So a very sort of broad question here. Can cancer patients on chemotherapy exercise?
Yep, I'll take that one. The short answer is yes, absolutely. Patients can exercise on whilst having chemotherapy, and we'll expand on that over the next couple of questions. It's worth noting that those early studies, so when exercise oncology was starting to develop as a specialty, if you like, those early studies, 2003, 4, 5, up to sort of 2007, were really looking at the safety and the feasibility of exercising during cancer treatment, particularly during chemotherapy. And they did find that exercise was safe. It was totally reasonable for patients to be more physically active, to participate in regular exercise during treatment without there being any adverse effects. Now, that's not to say that exercise is entirely risk-free, because exercise isn't. Nothing is risk-free. And what we're talking about there is actually, once you are more physically active, once you do participate in more regular exercise, you do slightly increase your risk of musculoskeletal injury, just as anyone else in the general population would if they were doing more exercise. That could be, dropping a dumbbell on your toe, to a bit of an ankle sprain or a muscle strain. So yeah, there is risk associated with that, but we try at best to try and modify that as much as we can. And certainly exercising in whatever shape or form it is does not sort of have any adverse effect during treatment. There might be times where you need to modify what you do. That might be on individual reasons. That might be because of the treatment that you're having, and we'll expand on that in coming questions. But no, it's good. It's something you should be doing, certainly.
Wonderful. Thank you. So what is the exercise advice for patients on chemotherapy going to a crowded gym? What are the infection risks versus the exercise benefits? There were a few different questions actually similar to this, but people were concerned about the infection risks. And it also says some chemo can affect cardiac function. Are there any precautions?
Yeah, I can take this one. I think during chemo there are important considerations that you have to go through, especially around safety, and particularly in relation to infection risk and kind of cardiac function as well. So some treatments can have an effect on your immune function. So many patients can be susceptible to infections. So going into a crowded gym during those times where you're immune suppressed isn't the wisest option. But this doesn't mean you don't participate in any physical activity or exercise. What you can do is you can join an online exercise program during those periods of time. You can use resources that are online. There's a lot of NHS resources. I know guys in St. Thomas Hospital has some really good resources as well that you can use. And you can also exercise or perform physical activity outdoors, with a lot of that research being revolving around brisk walking as well. Of course, your resistance training is also important as well, but it's trying to find a balance. You don't want to be involved. You don't want to be in a gym environment that could potentially increase your infection rate and then have an effect on your chemotherapy. But at the same time, it is important to keep moving. So it's about trying to find that balance in between. When we're looking more against the cardiac precautions, there are things that you have to look out for. For instance, if you before you start exercising or during exercises, you start to feel chest discomfort, unusual breathlessness, dizziness, or palpitations, that is a red flag. That's time to stop exercising and go back to your medical team and seek help from your medical team. However, if the exercise is staggered, if there isn't enough precautions have um, been put in place and the exercise has been graduated, exercise is perfectly safe. Like what Nicola was saying before, when you're looking at the research, exercise at the right intensity is a safe thing to do during chemotherapy, during any form of treatment. It is safe. But again, it's about having contact with a clinical exercise physiologist, having contact with a physio, a healthcare professional, making sure that the exercise dosage you're getting is at the right intensity for yourself. And also remembering that every movement is beneficial. So even if it's you going for a walk, even if you're someone that struggles to get out of bed during treatment and you're climbing the stairs more, you're doing activities of daily living that can help to improve your physical activity output, that's important. I think a lot of the people I see that are going through chemotherapy, sometimes give themselves a hard time because they're not reaching these guidelines that have been put out. But it's not about that. It's about graduating that your performance so you can get to that post-treatment. And we can, the main thing about exercise during chemo as well is about protecting that muscle mass, protecting that cardiovascular fitness, maybe not improving it, but at least doing something that is allowing us not to reduce that kind of baseline of fitness. Yeah.
Perfect, thank you. I think that would be reassuring for people. Let's look for another question. What sort of exercise is recommended during chemotherapy treatment? Are there any particular times in the treatment cycle that it might be better to be more active?
Okay, yeah, so I'll talk about those ones. So yeah, we've spoken about the guidelines. We've talked about sort of different types of exercise that you might consider. At the end of the day, though, the best exercise to do is the exercise or activity that you enjoy, that you actually feel comfortable doing, and ultimately the exercise that you will do. You know, we could talk to the cows come home about all of these other types of exercise, but if it's no interest of you, if not going to do it, you know, what is the point? So finding something that you want to do and you enjoy is the best form of exercise, whether that be going out for a walk, whether that's doing a yoga class, whether that's jumping on a bike, doing housework, doing chores, doing things out in the garden, whatever works for you, really. You do need to listen to your body, certainly. There may well be times during the treatment cycle where you need to modify what you are doing. We are going to put a link to a video that I think at some point during the session, and certainly when you get sent this out, of a video that we filmed here at React in Cambridge, where we go through, you know, if you're anemic, then do consider doing this. If you've got low platelets, consider modifying your exercise like this. So that's a really good resource to go and take a look at outside of this webinar. Just a few things though. We often find that patients feel quite nauseous for those first sort of couple of days, 48 72 hours post infusion. That might be a time to modify what you are doing. Immunity, as Isaac has already said, that can drop, particularly between day 7 and day 14, or if you're typically doing a 3-week cycle, certainly. So what we'll often find is that patients, if they're on a 3-weekly cycle, actually it's that 3rd week that they are sort of getting back up to what their baseline activity was. If you are anemic, again, lowering that intensity, maybe doing more light resistance work, because you might be feeling quite lightheaded, you might be feeling breathlessness, you might be feeling a little bit more fatigued. And obviously Claire's going to talk a bit more about fatigue and management for you as a patient group. Things, if you experience peripheral neuropathy, you might want to modify what you're doing then. Sometimes seated exercise, because your balance can be a little bit affected. So actually looking at things that you could do in seated, whether that's in a chair, whether that's on a bike, that might be your preference. But just to reinforce what Isaac has said, you know, if you are experiencing any new chest, jaw or arm pain, any unexpected vomiting or diarrhea, if there is any unusual blood pressure, so if your blood pressure has gone very low or it's gone very high, if there's any severe joint or bone pain, any bleeding or whatsoever, you must go back to your medical team. Do stop exercise in those situations and speak to your medical team and go from there.
Lovely, thank you. Another question, this time about immunotherapy. Are there any precautions to be aware of regarding exercising when having immunotherapy?
Apologies, that's me again. So no, there's nothing really different about or specific about exercise during immunotherapy that's different to what we have already said. So again, it's that listening to your body, and if you're feeling fatigued, then modify what you do accordingly. What I would say is that actually immunotherapy does boost your body's own natural defenses to fight the cancer much more effectively. There is growing evidence to suggest that exercise can support, possibly even enhance that your immune system to really boost the effect of treatment. They think that's because it increases T cells and natural killer cell activity, possibly reducing inflammation, boosting circulation to really aid anti-cancer treatment to directly affect that tumour. So it's an area to watch, certainly. So watch this space. I think there's going to be really interesting things coming from that.
Thank you. Yeah, more and more people are having immunotherapy now, aren't they? So it's useful to fit that in with that. So what about, there are also a few questions about exercising with a PICC line. So a PICC line is, you can describe, who would like to talk about the PICC line?
I think that's me again, sorry. So yeah, with PICC line is a peripherally inserted central catheter, which is a very, very fine tube that's inserted into the upper arm, and then it's fed through so that it sits in a central vein very close to the heart. And it means that you can have medication and chemotherapy directly delivered without the repeated trauma of having cannulas put in the lower arm. It is different to a port. Certainly, I would say you need to wait for at least 48 hours after that line has been inserted before you increase your physical activity, just because you want to let that insertion point heal over nicely. You can definitely exercise. So we do have people that walk, that go for a jog, that go for a cycle. I would avoid swimming, definitely, because of the infection risk. I'd also avoid contact sports, and there's quite a lot of instances where you want to avoid contact sport during treatment anyway. The other advice can be inconsistent, and Jo and I have spoken a little bit about this, and she might be able to chip in, but just about whether you can do exercise with your arm above shoulder level. So some places do say actually limit the overhead movement just to your shoulder level and avoid repetitive movement. So I really do think that you need to check with your specific unit. I don't know if Jo's got anything to add to that.
Yeah, Nicola, I think what we discovered when we had our chat before is that our hospital at UCLH maybe has slightly different things. So we don't particularly like you doing the bridge, which is where you're laying flat with your legs bent and you're like lifting your bottom up off the floor. But I think there's some guidelines coming out soon that have been published, that will be published soon, and that will kind of give us a bit more of an indication. And maybe start to set the standards across nationally of what we can and can't be doing. But at the moment, I guess the recommendation is to speak to your PICC line team about what they would be happy with, or your physiotherapist or your exercise specialist, until those guidelines come out and we get a bit more clarity nationally, really.
Great, thank you. Yeah, and if you're not sure, ask your team if you've got a PICC line, particularly if it's new. So I think this is a nice question because it is from a student, and that's so nice to be thinking about this early in the professional career. So it says, I'm a radiotherapy student and I would like to ask how physical activity can support patients during and after radiotherapy treatment, and whether it has an impact on treatment outcomes. Anyone?
Yeah, I'll take that one. So we have discussed this beforehand, some of these. So I don't think I'm being greedy and jumping all these ones. So yeah, certainly there's nothing sort of that's hugely different to the advice and the guidance that we've said already about exercising during cancer treatment. But for me, there are two key areas for those that are undergoing undergoing radiotherapy, one of which is fatigue. Okay, so fatigue is really highly associated with having radiotherapy. So Claire will talk shortly about how you can think about modifying your behaviour during radiotherapy, maybe for the coming weeks and months after radiotherapy has finished. For me, the other aspect is actually the impact on the particular area of the body where treatment is being received. So if you are having treatment over the chest wall for breast cancer, your pectoral muscles can be affected. If you are having radiotherapy for head and neck cancer, the muscles around your face, your neck and your shoulders can also be affected, not necessarily at the time of radiotherapy, but in the coming weeks. So sometimes it's not until sort of 6, 7, 8 weeks down the line that people report that they start to feel much tighter in those areas. So what I would suggest is that, because you can develop this fibrosis of the tissue, so radiation induced fibrosis, this tightening of the muscles, that loss of extensibility, any exercises that you might have been given post-operatively for your arm or your neck, continue with those to maintain that range of movement that you've got. I would be continuing those exercises for at least 6 months after your end of the radiotherapy, and that does come as a surprise for a lot of patients. I'm not saying patients get complacent, but you don't feel that you need to do those exercises anymore. You know, a lot of our breast cancer patients have done the exercises in order to have radiotherapy, to be able to get their arms up in that position. Once they've had the radiotherapy, the need for the exercise kind of drops away. But actually, I would really encourage that you do keep going with those exercises for a good 6 months.
Thank you. And I mean, having radiotherapy normally means traveling to the hospital every day for several weeks, doesn't it? So that can sometimes mean that that person needs to be more active than someone who might be having another form of treatment, such as chemotherapy, where you might just go once every 3 weeks. So that can be quite tiring in itself, the traveling, in my experience. Lovely, thank you. So I'm going to ask the next few questions together because I think that they would work well like that. What type of exercise, yoga, walking, tai chi, resistance, etc., are the most beneficial pre and post treatment? Also, what would be the adequate frequency to practice stretching during or after treatments, as it is known to have anti-inflammatory properties? And there's a publication there. And then also, does the type or intensity of exercise matter? What if you become conditioned to high intensity exercise to a level where it doesn't have the same impact as it once did? Is it important to continually evolve your workout and introduce variation? So I've just put those together because I think they all look at different aspects of the exercise. And does it matter what you do, the type you do, the intensity, frequency, and things like that? I don't know who would like to speak to that.
I can definitely start. I'll definitely start us off on that. I think when we're looking at, I think this is one of the most common questions I get is what type of exercise is best, and that varies. You couldn't imagine how much that varies depending on your treatment type, your status, where you're at, your age. All of these factors have an impact on that. When we look at the literature, most of the literature looks at aerobic training. That's where it started off at. So we looked at what effect does aerobic training have on your quality of life, your fatigue levels, and now we're seeing that impact that it can have at the micro tumor environment as well. But resistance training plays an important role, just as important as aerobic. We've seen that a combination of aerobic and resistance training has a huge impact. When we're looking at pre and post, when we're looking at, I think one of the best things to say is that, for instance, if you're a breast cancer patient, you might start more with aerobic training and range of motion focus rather than looking straight to go into resistance. You look to go to resistance after your range of motion has fully come back, and then you could look to improve your resistance. That could help to stop lymphedema buildup. When you're looking at head and neck, you might start with the resistance training, preferably to that aerobic training, which where you want to be focused more on when we spoke about more about your weight. So it's finding that balance which is specific to you and specific to your cancer type and your cancer stage. Resistance training has a huge impact when we're looking at how your lean muscle mass has an impact on your tolerance levels with treatment, and how that impact, that the amount of lean muscle you have is actually linked to your survival rates as well. So having a blend of multiple different types of exercise, be it aerobic, be it resistance, be it balance training, which is key as well. We need to see a lot of balance training, especially as you reach over 65 years old, or if you're suffering from peripheral neuropathy, balance is really key. And it's also going to be key if you've been sedentary for long periods of time. So it's having that balance of a wide range of exercise, but each exercise program is going to be individual to that individual's needs, if that makes sense. It shouldn't be just about picking and choosing, saying, okay, well, this research paper said that if I do a brisk walking for 3 to 5 hours a week, I'm going to improve my survival rates. But we might not have enough data for that when we're looking at other specific cancer types. So it's really important to have that variability and to follow those ACSM guidelines, which talk about 150 minutes of exercise. And we're looking at 30 minutes each day of aerobic or moderate intensity exercise. But it's also talking about having that two days of resistance days, 2 days of balance, and 2 days of core. So you're trying to encompass everything. There's not one treatment, that one exercise modality that is better than another. It's more about where you're at your treatment status and at your treatment time, if that makes sense for that question. But then when we're looking at, oh yeah, I'll leave it there.
Thank you.
I think I was going to just chip in at that point about the you mentioned about Pilates and Tai Chi and yoga, and those do have benefits for individuals as well, particularly if for example, if you've had abdominal surgery or pelvic floor intervention, pelvic floor radiotherapy, you may have had a stoma formation as part of your surgery, you might be someone that's already got pre-existing pelvic floor issues or low back pain. Something like Pilates is going to have real benefit for you and really enhance what you're doing in terms of the other aspects of exercise. Tai Chi is really beneficial to patients that were experiencing lots of joint pain and arthralgia. So that's a lot of our patients that are maybe going through the menopause or are having hormone therapy as part of their treatment, post chemotherapy rheumatism as well. Actually, Tai Chi is really, really gentle on the joints, but actually does encourage movement. So it's really, really good for that patient group. What it also does is it helps with balance, and it reduces risk of falling. So anyone that might be experiencing peripheral neuropathy, again, we've mentioned that a couple of times, so peripheral neuropathy in their feet, so not being able to feel the ground because of the pins and needles, the numbness, the tingling that you're experiencing, or it might be that you're having treatment for a brain tumor, brain metastases. It might be that you're not great at balance in the first place. Actually, Tai Chi is a fantastic way because you can do it sitting as well as standing. It can improve your balance and it does reduce risk of falls. All three of those have been looked at, have been researched in the oncology population. They've all been found to be great for your physical strength and what have you, great for your mental health and well-being, and safe and feasible during your cancer treatment as well. Oh, yoga. Everyone asks about yoga. So a lot of people who've got a lot of experience in doing yoga in the past are keen to get back to it. Fantastic. Great for your strength, great for your flexibility, great for mindfulness as well. Okay. And getting back to that normal activity. So we'd really encourage other types of exercise away from anything that just, you're working on sort of pure strength or cardiovascular fitness.
Thank you.
And then I think when we're looking at, I think the question I looked at stretching can play a huge supportive role during and after cancer treatment. I know there's a lot of emerging research that's looking at the kind of anti-inflammatory effects that stretching can have. That research is still relatively new, but watch that space. That's definitely going to have a major impact as time goes on. But in terms of frequency, when we look at the ACSM guidelines, we're looking at least 2 to 3 days per week, ideally 3 to 5 days per week in many cases, and gentle stretching can also be done daily. This is not something that is similar to your exercise regime, especially if the more you're exercising, the more you're going to need stretching to help reduce that risk of having injuries as well, as which we've spoken about those musculoskeletal injuries as well. Yeah.
Thank you. So I mean, the message is really that it's all beneficial, and but also it's beneficial to do something that you enjoy, and that there's so much variability, and really you need to be, if possible, linked in with an exercise physiologist, so particularly who specializes in cancer, or physiotherapist, or someone, because there's so much variety. But there is still a lot that you can do on without that, if you don't have that link. So I think the next question maybe we've answered. Are there any exercises which should be avoided? So I don't think there's any, from what you said, there's not exercises that should be avoided overall, but there are specific groups of people where there's certain things that should be avoided. I don't know if there's anything anyone wanted to add, or if that's what I've taken from what you said.
Yeah, I think it's mainly that. I think it's not avoided, it's adapted. So depending on your cancer type or your treatment status, it might just need to be adapted around um like for instance, if you've recovered from breast cancer, you're having range of motion issues whilst you're in your everyday life, you're not going to load that joint with weight. That wouldn't be a smart thing to do. You'd want to look at trying to improve your range of motion before you move on to improving your strength and your aerobic fitness. Yeah.
Thank you. I was just quickly flicking through the Q&As, and I just wanted, this obviously I came through while you were talking, I think, Nicola, just to say, to echo what you were saying, that encouragement in terms of exercise is really important. So I think, and that's something that those of us who are non-exercise specialists but are meeting people who are having cancer treatment can be supportive in terms of reducing the amount of sedentary time people have, or just encouraging people. We know it's beneficial and it can support the other anti-cancer treatments they're having. So just to add in that comment there. Let's go back to some of the questions that you've asked beforehand. What exercise is safe if you're at risk of MSCC? If you explain
Yeah.
what
Yeah, sure. Shall I explain that for, it's quite a specialist term that we kind of use. And what it basically stands for is a metastatic spinal cord compression. And what happens with that is that sometimes a cancer may sort of develop in the bones of the spine or in the tissues around the spine. And what happens is as that tumor grows, it can start to push on our spinal cord, which can affect how our nerves work. And this is considered a medical emergency. And so this is a really important question, and that obviously lots of people have questions about, and also healthcare professionals are also wondering what we can and can't be doing. And I think what we try to do in the NICE guidelines is trying to sort of say the key message is really to try to be active is still important, but the type of activity might need to be adapted, which is what like Isaac's been saying, is that depending on the level of risk and also where the spine is affected. But I think it's something really important is that the NICE guidelines do say that straight from diagnosis, everyone should be referred and offered some sort of rehabilitation. And that's really focusing on trying to improve your independence, helping you with your activities of life at home, and also trying to improve your quality of life. And I think it's really important I think patients, and we don't talk about that with our healthcare professionals, because things that have been said is they always think, oh, I haven't got time for that, so we don't bring it up. And I really urge anyone who is having that, then, to bring it up with your healthcare professional. But in general, they're happy with like low impact exercises. So things like walking, gentle cycling on a stationary bike, light strengthening exercises and mobility exercises, and things that really, what we're trying to talk about in that deconditioning cycle that we talked about at the very beginning, anything to try and maintain your muscle strength and balance and improve your general fitness. But when someone does have some bone involvement in the spine, we do like to try and keep the spine in a very neutral, supported position and avoid things that put excessive strain on that area. So things like that would be bending forward and lifting something heavy, or doing sort of really sort of forceful twisting. And so we might just sort of say do gentle postural movements. And actually it's really important to have some sort of supervised exercise specialist or physiotherapist supporting you. Because some patients, when they have the MSCC, they may be given a brace. And it's important that you need to know when you can go back and do things again. And sometimes I so often see that patients will come out that brace and then they've been told they can't do anything, and then they never really pick it back up with their healthcare professional to say, well, what can I start doing again now? And it's really important that you had that conversation. And I think it's just very much like what we've been probably hopefully bringing across in this webinar is that it has to be individualized to you. And if you need that support, it's asking for that support from your physio or your oncology team or even your nurse, because they can help you manage what the scans are showing along with your symptoms and just generally where you are. So it doesn't have to be really intense. Again, it can be beneficial just to try and help to, keep you nice and well and keep you active. Hello?
There you go. It was me that spoke while muted. Thank
It's
you.
normally me though.
So the next question is, when is it not safe to exercise? I think this is something that holds a lot of people back from offering exercise advice or exercising themselves because they're worried about situations where it might not be safe.
Yeah, and I guess I can follow up on that one from that MSCC. So obviously I've told you it was a medical emergency, and there are some red flag symptoms that would make us stop you from exercising, and we'd say seek medical advice straight away. And those sorts of things is if you get any new back pain, or if it started to become more worse, or it's more severe and it's becoming quite persistent. And because obviously sometimes if that tumor is pushing on that spinal cord, it will affect your nerves. And so if you start to feel like you get some weakness in your legs or your arms, or you're just feeling like your arms and legs aren't quite working properly. Also, other things to look for is if you start to feel any numbness or pins and needles or changes in sensation in those arms or legs. And also, if you're starting to have problems walking, that you just can't quite get your legs to go where you want them to, or you've started to experience more balance problems. And other two things is if you get any changes to your bladder or your bowel. And so the things that we'd be looking at that is if you're becoming newly constipated, or if you can't control your bowels and you haven't got any control of them and they're just opening. And that's the same for the bladder. If you're feeling like you need to go to the toilet but you're going, only a small amount is coming out, or on the other end that you are can't control your bladder movements, then they're the times when you really need to go. It's a medical emergency and go and get an urgent assessment and contact also your local healthcare team. And in these instances, we would say you need to stop exercising immediately. And yeah, it's really the main things really that we'd say stop exercising and seek medical advice.
That's good. Thank you. So people can know that without those things, they can feel a bit more free to offer exercise advice or to undertake it. How about what exercises should I avoid after removal of lymph nodes as a result of breast cancer, and why?
Okay, I shall take that one. So there's a couple of questions in the chat about that as well, about lymph node removal. The reason that these questions come up is because historically, if you'd had any lymph nodes removed as part of your cancer treatment, the advice was no exercise, no heavy lifting, no repetitive movement. And we're really trying to move away from that advice and guidance now. Actually, there have been some recent updates to the NICE guidelines. And full disclosure, I have been involved with the writing of those guidelines. And what are now in the recommendations is that, and I'm going to read directly to get the wording correctly, is that we should reassure people that there is no evidence to suggest that physical activity, including upper limb exercise, will worsen lymphedema, and that it might actually instead improve quality of life. There's been a further update to the arm and shoulder morbidity component of the NICE guidelines as well, which says that upper limb exercises are essential to regain function and reduce risk of developing long-term shoulder issues. So we couldn't really find any evidence out there that did explicitly say that if you exercise your upper limb, you're going to get lymphedema. The general thought is that actually not moving your arms normally can lead to deconditioning, and that may actually put you at more risk of developing the condition. That's not to say that there shouldn't be some caution with what you do, though. Okay, first off, you have got to follow the post-op advice in your particular unit, your particular surgeon, because sometimes surgeons within the same unit may give different advice and guidance, different protocols for the rehabilitation. And it particularly for those patients that maybe have had a reconstruction, or if you've had any vascular involvement. Okay, so that's really important that you follow what your trust and what your department is saying. There can generally be a little bit of what we call delayed exercise. So maybe for the first 7, maybe up to 10 days post-op, we may well say, look, please don't take your arms above shoulder level. Okay, so you're just coming up to that 90 degrees. That stemmed from some research that actually looked at seroma formation, that if you went straight into taking your arm above shoulder level whilst the drains were in situ or too early post-op, it might increase seroma production in that area. Repeated seromas can be linked with increased lymphedema risk. So that's why we do limit it a little bit to that initial post-op period. And then generally you gradually increase what you are doing. Isaac mentioned earlier, actually you don't go straight for strengthening, you aim to get good range of movement first. So we work on range of movement, and then we will gradually add in gentle resistance exercise, moving into weights. I noticed that there was a question about dragon boat racing. So that's something in the past that we would have advised you to avoid, very strenuous, very repetitive movement. But actually there was a series of research studies looking at dragon boat racing in the breast cancer population. They looked at patients that didn't have any lymphedema, so upper limb swelling. They didn't have any of that to begin with, and also groups of ladies that did have some existing limb swelling or diagnosed lymphedema, and got them doing dragon boat racing. And what they found is that it didn't worsen the symptoms in those ladies that already had the condition. In fact, it improved limb volume in some instances, and ladies in the non-lymphedema group didn't go on to develop that limb swelling, which was fantastic. What they didn't publicise, though, was that all of those ladies had been in a sort of a 2 or 3 month land-based training program where they gradually progressed through resistance and weight exercises before they got into the boat. So you can get back to doing exercise, high level lifting or what have you. We've got people that are doing sort of Team GB events. We've got people going back to high rocks events, but they have done that progression gradually over time. And if you can do that under the supervision of a healthcare professional, then fantastic.
Wonderful, thank you. I'm going to look for another question. Interested to hear about strategies for dealing with fatigue, as this is the biggest issue for me, even when well, never mind undergoing treatment. Long days, lengthy commutes, late evening meals all seem to contribute. And I think there was a question asked today as well about when everything feels difficult, how do you sort of make a start on this?
I'm very happy to take that one. And I think cancer-related fatigue is a very real, very common symptom. One of the most common side effects of cancer and its treatment, unfortunately, and can be a really big barrier to people, and not only kind of increasing their activity, but just doing the normal daily activities as well. So definitely something worth thinking about how to manage. I like to think of energy a bit like a battery, and I think pre-cancer we don't think about our energy so much. We kind of use our battery, it gets depleted, we have a bit of a rest or a sleep, and it recharges again. And unfortunately, cancer-related fatigue is a bit different. We have a smaller reserve, smaller battery to start with. It tends to deplete quite quickly, and once depleted, it's like we have no reserve. So people can often feel like they actually then just have to recover, and so that can be really difficult because people end up being active, hitting that kind of limit, depleting their battery, feeling really awful potentially for a few hours or even a few days, and thinking, well, I'm not going to do that again because it made them feel so bad. So again, sometimes managing that battery can be really difficult. But actually, it's really important. And I think, there's no magic pill for cancer-related fatigue, but managing your energy levels, thinking about kind of deliberately, being aware of how much energy you've got and managing that battery can be really important. And there are certain things that can help, like prioritizing what's really important, taking a bit of a delegate, ditch or do approach to activities. What can be delegated, what can be ditched, what is really important to do. And exercise and activity should hopefully be up there in priorities as well. Planning, so is there a better time of day to be active, a better time of day to rest? How much is going on in the week around appointments? What about the treatment cycles? When can I be active? So planning is really important in managing that as well. And then pacing yourself, so taking those preemptive rests to kind of keep an eye on your energy rather than doing a lot in one go and getting really depleted. So I think, pacing is this idea of just breaking things down, regular rest breaks, and trying to kind of maximize the rest by really allowing the mind to have a bit of a break as well as the body during those pauses as well. And I think that kind of conservation of energy and management of energy is really important. And a bit like a scale, that's really important in, using our energy efficiently, but we've also got to keep our body working efficiently. So we want to be keeping it active, reducing that deconditioning, because if we're deconditioned, every task we do uses more of our battery, so it tends to not go as far. So activity is really important in that as well. There's lots of information, out there on cancer-related fatigue. Macmillan have got some good resources. The local Maggie Centre in Cambridge, if you are local to Cambridge, runs a fatigue workshop. I know nationally Maggie's are really interested in doing a lot of fatigue work as well. So do access the resources if you need a bit more one-to-one support with it. But I think it's been said quite a lot here today, actually, the benefits of activity, even when fatigued, are really important. And it's been shown that activity can reduce cancer-related fatigue, but it's about getting that balance right. So we can be here as kind of experts in, this is how you conserve energy and this is what exercise you should do. But actually, you as a patient, you as a person with cancer are going to be the expert in knowing where that balance feels right. But do seek support with that if you need to.
Thank you, Claire. Another question which sort of fits in with that is, what is the role of exercise for people with terminal cancers?
Yeah, I'm happy to take that one as well. This is my patient population that I work with. And again, that term is quite broad. So we keep working with people who have an incurable cancer, but may have many years ahead of them, be still quite fit and active, and people nearing the end of life as well. And I think the role of exercise activity is going to change along that spectrum, but I think it's always important. So if you're having palliative treatment, again, exercise and activity is still important, keeping you stronger for longer, helping you to tolerate that treatment, helping with the outcomes. Equally, if you're coming towards the end of life, you might not be wanting to do as much formal exercise. It might just not be your priority, what you value at that time. But actually, it might be about kind of avoiding or preventing that avoidable deterioration. So really kind of thinking, okay, how can we optimize function? How can we keep you going in the things that are most valued? Engage in participating in things that are meaningful. So I think actually, even when people are having palliative treatment or coming to the end of their life, being active is often what keeps people going. It makes us feel like who we are. Whether it is going for that daily walk with the dog, or spending time with the grandchildren, or being able to sit and have a cup of tea with a friend and feeling like enough energy and strength to do those things is really important. So I think coming back to what people value and kind of incorporating activity at a level that feels appropriate. And it might not be we talk about exercise, it might be we talk about moving more, or just optimizing the things you want to do. I hope that answers that question.
Thank you. We haven't got a lot of time left together today, so I'm going to just ask these next two questions together. What exercise seems to be the most successful in reducing cancer reoccurring, e.g. types like weights, walking, running, bike, etc., and how much is indicated in a week? And also, is there a minimum amount of exercise that helps to prevent recurrence? And does the exercise need to be aerobic?
Okay, I'm gonna try and fly through it quickly because I know we don't have that much time. So bear with me. Most of the research sits with breast, prostate, and colorectal cancer. And when we look at stuff like reoccurrence, again, most of the research sits in aerobic training. It doesn't sit in resistance. So we haven't got enough research when we're looking at reoccurrence where we combine aerobic and resistance training. So one of the biggest trials that has come out in the last year, which was the challenge trial that a lot of people are speaking about, which looked at colorectal patients, looked at brisk walking, cycling, light jogging, or swimming. Those were the options that they got. And in that trial, what they found is that if you're exercising around, it is quite a big number. It's brisk walking for 45 to 60 minutes, 3 to 4 times per week. There was a 28% reduction in risk of reoccurrence of a new cancer or risk of death when we compared that with the exercise group and the group that had just exercise advice. So what that actually entails is showing that if you're exercising or you're walking at a brisk or moderate intensity exercise, it does have an impact for colorectal cancer. There's research coming out for aerobic and resistance training for prostate cancer patients and for ovarian in the next couple of years. So we should be able to speak more on that with more detail. A lot of the research that we've seen for breast cancer right now is association. So what we found there is a direct link between dosage and survival rates. So the higher the dose, the more exercise you're doing, the higher those survival rates were. And that kind of capped around 240 minutes of exercise per week. So ideally where you want to sit between is 150 to 240 minutes of moderate intensity exercise a week. But when we're looking at that minimal dose, what's the minimal dose is an area of research that a lot of people are looking into at the moment because we're seeing that, okay, if we're saying 150 minutes, that seems like quite a lot of exercise during a week's period. But what we're finding is that if you're doing at least 1 hour of brisk walking a week, that's going to have a minimal benefit. But if you're hitting the 2 to 4 hours of brisk walking a week, you're actually going into an area where it's actually going to be clinically meaningful. And if you're hitting upwards of 5 hours a week, you're going to get those full benefits of the exercise. So bear with it. There is more minimal exercise research coming out, especially looking at single bouts of exercises. So single bouts of high intensity exercise, single bouts of aerobic exercise at lower intensity, and single bouts of resistance training. And the early research is simply amazing. So stuff that's happening at the micro tumor level and at that the tumor microenvironment level is absolutely amazing. However, it's not enough research for me to come with good heart speak about it today. But what I would say is that brisk walking at a moderate intensity at the moment shows the biggest survival rates. Thank you.
Fantastic, thank you. And watch this space for sounds like more's coming, more
Most definitely
information
probably, yeah.
soon. Thank you. Um, so this question is exercise has an immense impact on mental and physical health. So we've been discussing that, but how do you measure the results? Is it by feeling by a kind of feel good factor, or blood tests, or is there any other ways that you would measure this?
Yeah, there's various ways you can measure it. So uh, the feel good factor is that qualitative data, and that data is incredibly powerful because from that data we get an idea of a patient's barriers to exercise and that the facilitators, things that allow them to exercise. And this is an area that needs to grow a little bit, needs a lot more research into why some people exercise and why some people don't exercise and looking at different ethnicities, ages. If you're at a working age, is that a potential barrier for you to come into an exercise program? How do we work around that? How are we more flexible to allow exercise to be a little bit more inclusive? But also, we're looking more at the fatigue and quality of life assessments. We're looking at subjective data, so we can use questionnaires that are validated, and we can test that at your baseline at 6 sessions in or 12 sessions in to compare how that improvement happened. We also look at physiological measurements. So it could be something as simple as BMI or measuring muscle mass or lean body mass to see has that change happened during treatment? Has there been any benefits from the exercise during treatment? And then if you've got a lot more money, you can then start to look at the blood. You can look at blood and you start to look at the tumor microenvironment. Did that single bout of exercise have an effect on those natural killer cells that Nicola was talking about earlier, or those T cells? Has that had an effect where we could say exercise plays a bigger role in cancer treatment, not just looking at quality of life, but also looking at how it affects the actual tumor as well? But yeah, thank you.
So thank you. So there's a lot of options there. I'm going to just race into the next question. Do you agree that exercise should be prescribed and incorporated into oncology clinical treatment plans, whereas it is currently not? We briefly touched on this earlier.
Yeah, I mean, I think this is the one that question where I just sort of hope that this is one day will be the dream, basically, isn't it? And I think that no, it's not standard of care at the moment, but I think what we're looking at is that cancer treatments are improving, survival rates, so people are living a lot longer, and we're getting such great medical advances. But it really does make me question, is our supportive care, like our psychological services, our exercise services, are they embedded in that pathway as strongly as what they should be? And I don't think they are. And we know that these are really powerful tools to help our patients go through treatment and to help you recover. And just like that, someone had put on the group at the very beginning, if it had been put in at diagnosis, we may have prevented some of those deconditioning cycles that we see. But I think what is encouraging is that we're starting to see a shift in that national policy. The National Cancer Plan, which was came out in February of this year, has now started to highlight that importance of prehabilitation and rehabilitation, which is our exercise. So I feel like there's there's now a national commitment to the exercise and people with cancer, and because we can see that it can improve patients' outcomes. So I think there's lots of excitement and optimism, and really hoping to see that shift of integrating exercise and rehabilitation into routine cancer care. Yeah, I think that answers it.
Wonderful. Thank you. It's hopeful. The future looks
Hopeful.
wonderful. I'm a cancer care coordinator. How can I motivate patients to exercise post-diagnosis or treatment if they did not exercise before?
I'm happy to take this one. So your motivation can often be quite challenging, and exercise can feel quite daunting. And actually, someone's also put something in the chat about kind of coming to things quite late, not knowing where to start. And I think a lot of people can find that, they maybe have never exercised, and then actually they know that exercise is really good for cancer, but it does feel quite scary. And I think I would always start by being really curious with that person about what they value, what is important to them, what they enjoy. Even if formal exercise isn't something they've ever done, actually, do they enjoy walking around the park with their friends? Or is there something that they've done previously? Do they enjoy swimming as a child and have not done it since? Just being really curious to try and understand what people value, what's meaningful. And then trying to use those to inform appropriate and meaningful goals around activity and moving more, even if we're working up towards exercise. So starting from that kind of curious approach, I'd say. And if you're someone, again, the person writing in the chat just not know where to start, again, thinking what your own values are. There's some values checklists out there. There's lots of things that can help you to kind of think about, okay, what's important? What could I do? And knowing that anything is better than nothing. I think it's been said here before, like starting somewhere, just taking that one first step. Goal setting is really helpful for that, because you can just set yourself one small achievable goal. And then once you've achieved it, it feels really motivating. Go, okay, what else can I do? But making sure it's small, achievable, and go from there.
Thanks, Claire. I'm aware we only have a few minutes left, and the next question could be have a huge answer, but if we can just touch on it here. I'm a physiotherapy student. I'm looking for research areas to expand my knowledge. What research topics do you think are the most important areas for physical activity in oncology currently, and what questions would you like to see future research address? There's a couple of bullet points there.
Well, I was going to just talk a bit about it's quite an exciting area to be in, and just very quickly, I think is that our solid cancers have quite a lot of research, and when we're looking at exercise, they have hundreds of papers, whereas I feel like those hematological cancers, we don't have as much. For example, the Cochrane study in 2019, we only had sort of 18 studies that they could really look at for hematological cancers. So I think it's really important that maybe we prioritize looking at those kind of patients, and also how we kind of get, I think like what Nicola was also talking about, is how we do this research, but how we then put it into clinical practice, and how we sort of make sure that these programs can be done to scale, and also really make, focusing on how we can implement exercise into clinical pathways, and also bone disease.
Thank you.
Anyone else?
Yeah, I would really second that, especially when it comes to real world practice. I'm going to be quite biased because I want to see more kind of community-based exercise, and seeing how exercise can be translated into the community, but also think about looking at barriers, because a lot of the research is based around particular clean cut laboratory research. So it's maybe taking it away from that into the community, so we can find out why certain individuals have barriers to exercises, what are the cultural barriers to exercise, how do we change that? How do we make it more inclusive for every individual to be able to access exercise? If we're going to say it's part of the cancer treatment, there is a need to make it more inclusive to everyone.
Thank you. I'm sure there's even more, particularly from your own research, that you'd like to delve into. I'm sorry we don't have the time today. I'm going to ask one last question because I think this is really important and it also brings together quite a lot of the things that we've talked about. How do we increase the confidence and knowledge of healthcare professionals to encourage patients to be physically active, and how do they refer or signpost to appropriate activity?
Yeah, and I can answer this one. And I think you're right. It does sum up everything that we've hopefully been trying to sort of talk about in this webinar, because we know that healthcare professionals do play a key role in really shaping our patients' behaviour. And I think that the thing we need to do is they talk about having a lack of confidence to discuss physical activity in surveys. And I think the most important thing we can do is really have education and recognising that giving patients good, clear guidelines, good like training plans, and also giving them the accessible resources will help us to have confidence for our staff going forward to have these discussions. And I think really it kind of goes back to what I was kind of also talking about earlier, is really embedding it now into our pathways so that the emphasis doesn't always come on the doctors and the nurses, and that we have within these teams like a multidisciplinary team, so that we've got physios that are in there and also occupational therapists to talk about how we manage exercise and also how we manage, that fatigue side of things. And I also think we need to have like really clear pathways, because I personally find working in London that we have so many different communities around us, and what happens is that they all have different referrals. Some of them cost and some of them are free, and so I feel like if we could actually make it a bit simpler for our staff about how to have clear access to these exercise pathways in our community, that would also be really helpful. And also these communities going to our staff to sort of like help them. And I feel like these are the sorts of things that are really going to help us to start to integrate exercise into our patients' pathways.
Thank you. I would hope if there's any healthcare professionals on the call today as well, that listening to you guys and all your expert input there, that might help people to have a bit more confidence to deliver some first line physical activity advice, or to support that's been given by the specialists. Or anyone listening later, that will hopefully be helpful. And also, I would hope that if there's anyone who is living with cancer at the moment and does not have access to this specialist input, that you would feel able to ask your healthcare team, because there may be things available that you aren't aware of at the moment. And if there aren't, then you asking does help to support that, to show that there's a need there for this valuable information. Thank you. I'm sorry for the questions that we haven't been able to answer today, but we have run out of time. Thank you so much for everyone that's engaged with asking these questions, and obviously our wonderful panelists for all of your expert input to answering them. Thank you so much for joining us today, and enjoy the rest of your day. Take care. Bye.